and welcome to another episode of Coffee Time. I'm your host, Erica Cianciarusso, and today I have a special guest with me. Please welcome Dr. Stacy Neal, the Director of Academic Clinics and Associate Professor. Hi. Cheers.
Cheers.
Thank you for being here.
Yeah, you're welcome. You're welcome. How exciting.
I know. I'm so excited to chat with you because I have heard so many cool, exciting things about you and about your past and what's led you here to NWHSU. So we're going to just get right into it. And I want you to tell me a bit about your interesting profession that you had before becoming a chiropractor.
Okay. Well, I am a retired special agent with the Department of Homeland Security, and I primarily did a lot of human trafficking, so anti-human trafficking unit, but I was in an anti-narcotics unit as well. And then I had actually gone to the Federal Law Enforcement Training Facility for some advanced training.
Wow.
And while I was there, I actually wound up getting injured, and the injury really was quite extensive in the beginning. Didn't realize how extensive it was, but I landed on both of my knees, foot stayed in place, wearing about 60 pounds of gear, and I got flung forward because the guy who was behind me didn't see me go down.
Oh,
so
no.
I wound up landing on my face and my shoulder, and 11 surgeries later.
Holy moly.
So 4 years, 11 surgeries. And even though all the doctors who put me back together again, they really didn't make me feel whole, but it was a chiropractor who made me feel whole.
Wow.
And so I started seeing this chiropractor, and he would say really great things like, hey, when you come in, why don't you leave your cane at the door? You know, go on. Stacy, leave your cane at the door. And eventually I left my cane at the door. And so the administrative staff, they gave me a call and they're like, oh my gosh, come back and get your cane.
Is that something that you thought like you weren't going to be able to live without?
Right. It was a mental and physical thing. So it took a toll on me because my whole life I had been in law enforcement or some fashion.
Right.
And I was a firefighter for a short period of time as well. So to go from that, really high impact job to being injured, so injured that I'm using walkers and canes to get around, and then knowing that I was going to be medically retired from my, my career,
right.
It was really traumatizing. And so the chiropractor was the one who really made me feel whole. So he made me feel seen, like a whole person. And then he's like, hey, what are you going to do with the rest of your life? Because
right, you couldn't go back to what you were doing before.
Right, exactly.
Right?
And so he's like, you can't just do nothing. I mean, you're young, you still have a lot of life to give. What are you going to do? I said, God, if I can make people feel the way that you make me feel, yeah, that's what I want to do. I want to do your job.
And
he was like, well, go apply.
Yes,
so
apply at NWHSU.
Yeah, he did. And so I asked, well, where's the school at? And he explained where it was, and he explained all about it. And so that's what I did. I applied, and I got accepted. I wasn't sure. I mean, I have my bachelor's, I have my master's in science, but it's nothing compared to, going to school to be a DC.
Right.
So, yeah. But
wow.
I did it, and here I am.
That is a huge career change.
Yeah.
And what advice would you have for a student that is maybe in a similar position?
Oh, my gosh. I would say do it. I mean, there's nothing wrong with a second career, and it makes you invigorated. It brings new life to you. And you do feel like you lack something when you kind of reach this end to a previous career, right? You're like, oh, now I'm not relevant.
Yeah.
Well, make yourself relevant again. I mean, apply. Go and do it. You'll be surprised.
Right. When one door closes, another
one opens. Yeah.
You don't know what awaits.
You're right.
And as both director of academic clinics and assistant professor, you have a unique perspective on how our students grow throughout their clinical experiences, which is a huge part of their education here at the university.
Yeah.
What do you find most rewarding or even most exciting about helping guide the next generation of chiropractors?
Oh my gosh, the most exciting thing I think is watching a student go from being in a didactic program in a classroom to being clinical. So that bridge, that aha moment, oh my gosh, it finally makes sense.
Yep.
That's my favorite thing in the whole world. I love to watch them go, wait, now I get it. I completely understand.
Now I feel it.
Yeah, I feel it.
can
I'm
do
there.
it.
I'm in the group.
Yes.
Plus, everything changes. Their personality, the way they dress when they come to school.
Wow.
It's like they become a professional. So
And they have more confidence.
they
as
have more
well?
confidence. Yeah. Oh, you can just see it. You can see the wave. It's awesome.
That's so exciting.
Yeah.
And you'll soon be joining the university in another capacity, right?
Right.
So adding another title to your numerous titles.
Yeah.
You're going to be practicing at the Bloomington Clinic and specifically specializing with the Activator Method.
Yes.
Can you tell me a little bit more about this method and how you're incorporating it into your practice and how it helps people?
Okay, yes. Activator Method chiropractic technique is really, for me, it was like a three-prong decision. You have precision, you have, it's gentle on the patient, and then it has scientific evidence that backs it up. So when it's gentle for the patient, then it's also gentle for the practitioner, which was really important to me because I didn't think I was going to be able to have the stamina or the longevity for my career to be able to put patients into different positions.
Right.
And save my back. That having a spinal cord stimulator and not being able to really bend
Right.
over and do things the way that other people can, and this awarded me that.
Okay.
So having it being gentle for the patient and easy on the practitioner, and then having scientific evidence that backs it up. That's the thing that sold me.
How do you see the Activator Method benefiting our population here?
Oh, I think that it would benefit greatly. One, there's a lot of patients who really don't like cavitation, and cavitation is the sound that is made when a body, when the gases are released.
Right, it's just something that
yeah, and
irks
sometimes
them.
it really, freaks people out.
Yeah.
And there is no cavitation with Activator Method, so I use an activator adjusting instrument that's a 5, and so it's like 10, 20, 30, 40 pounds per pressure, and we can on the lowest level adjust babies all the way up to osteoporotic adults. So it's got a wide range, so not only could it be beneficial to the students, the aging staff, all of their family members, so it's really it's a tool that really can be used across the gamut.
And that's interesting what you brought up too about, it's about taking care of the patient, but also taking care of yourself as a practitioner. And we see that in massage therapy too. With our programs here, it's really important. And I think that's an important skill that our students come away with, right? Is self-care and how to care for themselves while also providing the best care.
Yeah, and this was the best thing for me because I thought, wow, I'm going to enter into the school. I'm going to become a chiropractor. But I started to really get worried. Was I going to be able to have longevity with this?
Right, like how could you fit and stay and continue to do this? So this
But it
path.
was an instructor, my very first trimester, who said, I bet you might be interested in Activator. And I was like, really? What is this Activator?
All right, you're like, tell me more.
Yeah,
Good.
yeah.
And so you've seen the profession evolve in many ways, right? From your perspective, thinking ahead into the future, what does the future look like in your opinion, the future of chiropractic, especially when it comes to integrating evidence-based care and collaboration across healthcare disciplines?
Ooh, interesting that you brought up those two words because
Those are big words
yeah.
for us, I
Well,
know.
I see it as collaboration and evidence-informed practice. So I really see this progression where we absolutely are collaborating with all other, like all allopathic, all holistic, and we're all just one trying to support the person. So I see it as person-centered care where we're able to change that patient thought and we're just working on that whole person all the way around. So that's what I see chiropractic leading that edge.
Definitely, that's where we're going.
Yeah.
And so, Stacy, you wear a lot of hats, and another one is that you are an active member of our Chiropractic Alumni Board.
Oh, yes.
Yes. Why do you think it's important for alumni to stay engaged with NWHSU?
Well, alumni are really the lived part of it. So we've lived it. We've walked the halls, we've sat in the same chairs, and we emerged on the other side. So we're going to be able to be the mentors. We're going to be the ones that are going to be able to say to the student, hey, let's take this education and show you the professional side of it.
Right, show you where you can take it.
Yeah, let me show you the clinic. Let's be that elevated bridge to kind of guide you from one location to the other. So we're the ones that are going to be able to bring back and be able to talk to the students and kind of guide them across the bridge.
At the root, it's really about mentorship.
Yeah,
right?
Exactly. And pride in the school.
Oh yes, of
so
course.
So giving back and supporting the school so that we can watch it continue to rise and see the innovation that's occurring is, it's priceless.
And how are some ways that alumni could get involved?
Oh, they can join the Alumni Board, which I would love.
Check it out.
Yeah, shout out. I'm the Vice President of the Alumni Association, so
always
come
looking
and join
for more
us.
people, right?
Yes,
Okay.
absolutely. They can come for lunch and learns. There's lunch and learns that occur.
That's right.
Yep. So they could join that program. I think Katie Hargis would be the person to talk to about that. But yeah, they can join and do some lunch and learns. They can come and do any kind of mentorship at the university. They can give back financially, which is a huge thing too. I know that we do things like the spinal sprint, we do the golf tournament and all of that, but the Alumni Association has a scholarship specifically for students. And so you can donate directly to the Alumni Association and actually affect a student's education.
Wow.
Yeah.
Yeah, and any help at all goes a long way.
It does.
Right?
It does. It doesn't matter how much it is. It doesn't have to be $500. It doesn't have to be $1,000. Anything will help.
Love that.
Yeah.
Well, that is our time for today. It has been such a pleasure talking to you, Stacy.
Yeah.
Thank you for being here.
Yes, thank
and
you.
We'll see you next time on Coffee Time.